to Debbie.
So thank you, everyone. It's nice to be here, and I can't think of a more fitting tribute to Bala than to open up the meeting with a recognition of his efforts over the last, I've known him for 18 years, and he struck me as the most positive person ever. And every event or meeting that I was in was always better because Bala was there. So I hope you all have had the same experience with him. And I'll move on. So my name's Debbie Jennings. I work for Chesapeake Region Safety Council, and I've had a diverse highway safety career and have been fortunate enough to work at local levels in Calvert and Anne Arundel County, as well as for the Highway Safety Office, and now in my position at Chesapeake Region Safety Council. So today on the agenda, one of the things I wanted to talk about was a program that I've mentioned a few times in passing during some of our events as far as opportunities for all of you to attend. But we're going to go in a little more detail today. On the call is Tom Morehouse. And Tom, you can certainly chime in at any time because a lot of what I'm going to talk about could only be done because Tom and Baltimore County Police have participated and in some cases led the effort. I'm going to try to share my screen.
Deb, do you mind if we do approve the minutes first before we jump into the presentations?
I jumped right in, didn't I? Yes.
That's okay.
Please.
No problem. Does anybody have any changes for the minutes that I had sent out? Any objections to approving those minutes? Okay.
I'll make a motion to accept them.
I'm sorry?
I'll make a motion to accept them.
Oh, okay. Thank you. I was going to say, I'll take silence as acceptance too. So, thank you. All right. Right back to you, Deb.
Thank you. So the program I'm going to talk about is an effort that we started in 2019 with, at that point, Frank Enko, who is now with NHTSA, but at the time was the traffic training coordinator for Baltimore County Police. And it involved at that point just a simple awareness and education effort for our internal staff. And we hired actually Baltimore County and some other drug recognition experts to train our staff on what impairment looked like, specifically by cannabis. And so we knew that there was a need for this. This is an up-to-date chart, but as you can see, the states that are in the dark green are now the legal recreational states across the country. There are 38 of them, unless there's an up-to-date number beyond what I knew in August. And then the light green states are the additional medical cannabis states. Chesapeake Region Safety Council spends much of its time doing training and education programs, and primarily for employers. And often those employers are in the construction industry or other safety industries that need to conduct reasonable suspicion efforts, as well as have employees that may be affected by their ability to work on the job while impaired. So data that we had in place back about a month ago was that the Insurance Institute of Highway Safety said that there was a 5.8% increase in injury crashes and a 4.2% increase in fatal crashes for those states that have recreational cannabis legalized. And when it comes to the workplace and National Safety Council's efforts, you can see the data there that there is 55% more industrial accidents, higher absenteeism, and more injuries for those same recreational states. So our focus really started in July of 2019, but has become more and more centralized on training employers and safety professionals and highway workplace individuals on what impairment looks like, specifically to cannabis. If you look on our website, you'll see some videos on our YouTube channel, and this is one that I find particularly relevant. It's one of the first interviews that we did with a medical cannabis patient as to why he uses and why he is capable of working, in his opinion, during those days. This is one of our first cannabis efforts, and I want to highlight it because you can see the cannabis users all around the table, and the law enforcement and staff members are way far back. And that has changed over time, and I'll show you a picture of what it looks like now. And this, of course, was the actual very first drug recognition experts time in our classroom with one of the cannabis patients, and he's doing his evaluation there. And this is that first night where, after the cannabis users smoked, our staff were working with the DREs and the cannabis users on their SFSTs and evaluations of impairment. And this is what it's sort of evolved to. Now we work with Tom Morehouse and other agencies. We just had Maryland Transportation Authority police in one classroom, concurrent with a Baltimore County police-led group last week. And we're filling classrooms with law enforcement. The law enforcement coordinator for the event is doing their Cannabis 101 update for about a 4-hour training before they come into our hands for the cannabis use and evaluations. And now you can see, instead of it being, one law enforcement officer per DRE with each patient, now they're working in groups. The patient there is on the left. His name is Mac, and he's been with us pretty frequently. But there's large groups of law enforcement actually being shadowed by workplace safety professionals now as they do their evaluations. And this is what the lab looks like. The first one you saw the 5 or 6 patients sitting at a table by themselves with nobody paying any attention to them. And now this has evolved to the patients educating law enforcement and the workplace safety professionals as to why they're using, how long their use effects last, why or how they can hide their cannabis use from an employer. And the conversations are really good all around, because as we move to the patients being evaluated, they are also thoroughly educated by law enforcement as to why they are or are not considered impaired. Included in the training is a briefing either by law enforcement or one of the county's prosecutors in reference to updated laws and information that they want to share during the program. In this case, it was Dave Daggett, who just retired. And this is a most recent report out at the end of the program after use. And you can see that not only do we have law enforcement, we also have safety professionals and the cannabis users in the class. So at the end of the day, last week when we did this, we had 84 individuals that were in the building just for this program, between the users, the law enforcement officers, and other people that were interested in what was going on. Usually it's a pretty much 50-50 split between workplace and highway safety professionals and law enforcement. And I had some technical difficulties at the very end when I was trying to put in a link to this class. So this impairment education class for non-law enforcement is free to register. We have 4 of them in the remainder of this year. 2 new ones will be coming up on our website that are available in Southern Maryland. The one that is scheduled for October 12th is full, but anybody interested can register for free on our website by going to chesapeakesc.org and typing the word impairment in the search bar. It's the easiest way to get there. And then if you're interested in attending impairment cannabis 101 class that is for law enforcement only, you can reach out to Tom Morehouse or go to the traffic training team link on the Baltimore County Police website. Tom's group is very kind in letting other agencies enroll. And if anybody in here is from a law enforcement agency and you want to set up your own training class and use our facilities, we'll work with you on that. We don't charge for the room or the amenities that come with it, such as lunches and snacks. And with that, I'll take any questions. Okay. So I'm going to try to scoot back to the agenda. And Cindy, can you open up the next agenda item while I transfer over?
Sorry, I was answering a question in the chat. I might not have been sharing my screen earlier. I apologize for that. So let me come back and share agenda. There we go. So any questions for Debbie? That it's such a great effort and program and first of its kind in bringing in employers and going just beyond the law enforcement aspect of it, and then also taking it backwards and letting the patients educate all the rest of us. So
if you can see Tom Morehouse on the call, do you want to ask him if he's got any comments to add? I know I went through that really quickly. Tom, do you want to unmute yourself and say anything?
Yeah, hey guys. No, it has been a great partnership. It's been growing exponentially over the last couple of years. And we're going to have I think we're looking at trying to do even more classes next year in 24. But I think what I get out of that class is seeing the growth in the cooperation between the students and the volunteers and the patients. When I first got involved with it 3 years ago, there was still just a little bit of, unease and nervousness, and should we really trust each other? But now, we go walking in, especially if it's some of our regulars like Rick or Mac or whoever, we go walking in and it's like meeting an old friend. We're like, hey, welcome back. Good to see you again. How are things going? And I think that's important because those two communities for decades, long before I got into the police work, and for decades while I've been in police work, have usually been at odds. And now we're starting to get on the same page because we both understand we're coming from the same point of view, right? We just don't want anybody being irresponsible out there and hurting people. So, yeah, I'm very proud to have been able to be a part of this and continue being a part of this.
great.
Thank you, Tom. These patients are actually doing a session at the conference that we're holding next week at the Maritime Institute. Information about that's on our website as well. But they're going to offer information to employers about why they believe that medical cannabis, or actually cannabis as a whole, has medical benefits, and why employers should be more open-minded as to allowing their employees to use it and take it off their testing schedule. So it's going to be an interesting session. I'm facilitating it.
It looks like Barry has a question. Go ahead, Barry.
Yeah, thank you. I was wondering if you could just review the two slides with statistics, because they really stood out for me. The one from IIHS with the highway increases, and the one from NSC with the workplace increases.
Yes, so I'm not going to bring the slide up again, but I'll talk through them. So National Safety Council has had put out, and I think it was in 2022, I usually cite my source, sorry. I think it was 2022 in a Safety and Health magazine article that said that states that have recreational cannabis as legal had 55% more industrial accidents, 85% more injuries on the job, and 75% higher absenteeism. Now, what those change in numbers are, as far as numbers, not just percentages, I do not know. They weren't listed in the article, but what I can do is I can pull up the article again, find out the author, and get a little more research on it and send it out and include in with the minutes, because those are startling numbers. And then this isn't really data that I have the source listed for either, other than it's insurance industry for highway safety. but they had, I'm trying to pull up my numbers. They had said that there was a 42% increase in fatal crashes and, come on, a 5.8% increase in injury crashes for those states that had recreational cannabis. And I think when I did this slide about 2 months ago, and I think I pulled that directly off their website.
Thank you.
You're welcome.
And some of you may be wondering if I'm over here wondering about her using the word accident, because I asked Debbie that myself several years ago. And it's because they're industrial, so they are accidents. They're not traffic crashes. But whenever
Yes.
I see a word, I ask.
Yes. And actually, that information will be part of one of the sessions at the conference next week as well, because one of the sessions is on workplace safety and cannabis legalization. So it'll be an interesting couple of days for us in the highway and workplace safety world.
Great. Any other questions?
Okay, let's move on to the federal safety update.
Frank, you can start if you want to share your screen.
Yeah.
And you can admit that you were in several of those photos, so you are a rock star for today along with Tom.
Frank started the program. He was our first contact.
So yes, so thank you. Thanks for inviting me today, and great presentation, Debbie. And great job over there, Tom. Yeah, who would have thought that the program would have grown by leaps and bounds from the first time that Debbie and I talked back in 2019. 2018, 2019. So it is a worthwhile program, and I tell you, more and more agencies are doing cannabis labs across the country, and you know, there's interest from Delaware, there's interest from Virginia now as well, from law enforcement, because it's something that we're going to see, and I think that the reason you're seeing law enforcement and the partner more, or there's not the law enforcement standing on one side of the room and the patients on the other side of the room, if you will, is because law enforcement realizes that it's here. And you know, if I think law enforcement's kind of, if you want to smoke cannabis, that's fine, but just don't get behind the wheel of a vehicle. The same is when it comes to alcohol. If you want to use alcohol, just don't get behind the wheel of a vehicle. That's the key. And I think you're going to see more and more messaging that goes along with that. So I am here today to talk about a couple things that we have going on with NHTSA, and that the region. I'm from NHTSA Region 3, as you heard from Debbie and Cindy. Before I came to NHTSA, I was with the Baltimore County Police Department. I developed our traffic training team and ran our drug recognition expert program, and was one of the assistant state coordinators for the DRE program as well. After I retired, I came here to NHTSA. I'm the law enforcement liaison for Region 3, and I'm a regional program manager in charge of, for right now, West Virginia and Delaware. We're kind of shuffling things up a little bit, but the LEL lets me get around and do a little bit of everything. And we all also have a few program areas. And one of my other program areas is pedestrian safety. So we have October is Pedestrian Safety Month. And NHTSA has some things planned that we'd like the states and all of our partners really to promote for us, with getting the word out about, you know, our most vulnerable roadway users, pedestrian and bicyclists. So when we talk about walking, bicycling, you know, walking is the oldest, most primitive form of transportation. It's good for the environment, zero carbon imprint. We could go on and on and on. It's economical. But, you know, and a lot of folks are walking because maybe they don't have the means to to get around any other way. They're using public transportation. And really, at the end of the day, all of us at some point become a pedestrian. If you drive to the light rail station and then get out of your car and go to get on the light rail, for a moment there, for a little bit, you're a pedestrian. You go to the shopping center, you go to the grocery store, etc. You know, you're a pedestrian. So we all at some point become that vulnerable roadway user. Starting in 2018, NHTSA started with Pedestrian Safety Month because pedestrian fatalities have increased. We were at our lowest level with pedestrian fatals in 2009, at a little over 4,109. It increased to 2021, and almost doubled to 7,388, and that's the highest since 1981. In 2021, there were estimated 60,000 pedestrians injured. That's an 11% increase over the previous year. And you know, the most impacted are older, younger, and the other message we want to try to get out to pedestrians is not to use some type of impairing substance and walk, because unfortunately we see a lot of pedestrian injuries and crashes where the pedestrian has consumed too much alcohol and has that measurable BAC. So that's some messaging we want to get out of pedestrians, is to be responsible as well as to motorists. And that's the other part here with Pedestrian Safety Month, is to watch out for pedestrians, to keep an eye out. You know, don't drive distracted, slow down, don't drive impaired, and look for those pedestrians that are out. You know, the time's going to change. It starts getting darker earlier, and we want motorists to really watch for those pedestrians, because pedestrians are vulnerable. I think everybody here would agree with that. And it's the motorist has that duty as well, to kind of watch out for the pedestrian and watch out for those vulnerable users. So NHTSA and Federal Highways, the official Pedestrian Safety Month started in 2020 to raise awareness. Started talking about it back in 2018, but it officially came to fruition in 2020. So when we talk about pedestrian safety, kind of the framework and focus is using the safe system approach, where, you know, we know that deaths and serious injuries are unacceptable, and we've all heard of the safe system approach. And you know, when we talk about safer people, that includes bicyclists, pedestrians, those who have mobility issues, and of course motorists. And so the safe system approach encompasses everything from safer people, making our roadways safer, not only to drive on, but to bike on, to walk on. Safer vehicles, you know, all the various technologies and vehicles, and getting folks to slow down ties in with safer speeds, roadway design, along with, you know, law enforcement's role in making our roadways safer as well, with safer roads. And then unfortunately, if there is some type of crash, that we get that really good immediate post-crash care, not only on the EMS side of things, but also scene safety and traffic incident management when it comes to keeping our first responders safe. So when we talk about pedestrians and walking and biking, it's healthy, it's an efficient mode of transportation, and we want to focus on those most at risk. And by doing so, we're human-centered, right? And that's aimed at reducing injuries and deaths of those who are most at risk, like older folks, children, who are likely to sustain greater injuries if struck by a vehicle. They're the folks that are most at risk. You know, pedestrians, bicyclists are most at risk when we talk about pedestrian safety. So we have a resource guide that you can get. I'm going to talk in a second on the next slide on where to get that. There's a webinar coming up on Thursday, October 19th, right in the middle of Pedestrian Safety Month. I sent the link to that to Cindy already, and maybe she could send it out to everybody in the group. and there's a registration link. You just have to register. It's open to everybody. And I would encourage you to attend that webinar. It's from many of the federal agencies involved, not just NHTSA, but federal highways, federal railways, Federal Transit Administration, everybody kind of involved with pedestrian safety. So it's going to be, I think, a very interesting webinar on Thursday, October 19th at 2 p.m. Again, if Cindy doesn't have the link, I'll send it to her, and again, she can push it out. This really takes, everybody to get everybody engaged and collaborate with for pedestrian safety. And, it's part of the US DOT's National Roadway Safety Strategies. They're called to action efforts. So we want everybody to really focus on, not just October. October, we kind of highlight it, right? But to really bring it to everybody's attention year round. And one of the places you get some of these resources, there is a resource guide. It can all be found on trafficsafetymarketing.gov. And I would encourage everybody to go there. The materials there are free for everybody to download. You can't change any of the materials around with the NHTSA logo or anything, but the materials there are there for you to use. That playbook, if you will, is there, that resource guide, along with all types of graphics for all the various social media, along with other media and sound bites and everything is all on traffic safety marketing. So tied in with Pedestrian Safety Month is also Slow Down, Move Over. Maryland has a robust, if you will, move over law. One of the better, I'm from Maryland. I worked with MHSO for years. I'll say one of the best move over laws in the state. And slow down or move over for all vehicles. And NHTSA has always been move over, move over. We're starting to change our wording as well to slow down, move over. And this protects our first responders, number one. Number two, and across the board, the law was originally put in place to protect those first responders. But think all the people at roadside, our construction workers. We just had that tragedy earlier this year in Maryland. So our construction workers that are out there every single day make our roadways safer with new roadway design and everything that they do, upkeep of our roadways. But our folks driving tow trucks, are driving, getting disabled motorists off of the roadway and helping them, and the folks from CHART, etc. So it's for everybody, even just the person that may have broken down on the side of the road and is waiting for help. So we want everybody. And in Region 3, we have the first 15 days of October, and I really can't give you a why. There's anecdotal data all over the place why Columbus Day weekend or the first 15 days of October are the most dangerous in Region 3, NHTSA Region 3, which is Maryland, DC, Delaware, Virginia, West Virginia, North Carolina, and Kentucky. But especially October 6th through the 9th, that Columbus Day weekend, seemed to be the most dangerous for us here in this region, for motorists in this region. So for years now, probably about the last 6 or 7 years, we've been conducting Operation Crash Reduction, where we ask law enforcement to conduct high visibility enforcement, coupled with, from the highway safety offices, a lot of media to get the word out, to have folks, wear their seatbelts and slow down and not drive impaired, not drive distracted, those 4 most dangerous driving behaviors. And in Region 3, that's our Operation Crash Reduction. And this year, we're asking the other message to get out there with it is slow down, move over. To pick, NHTSA hasn't picked an official weekend or day within the month of October for slow down, move over. We're asking states to, if they could, or groups, if they could, to get the word out there about slow down, move over. And then if they want to pick a weekend to actually do some enforcement, coupled with, public information and education, coupled with some high visibility enforcement. And we're also encouraging that during our Operation Crash Reduction, which is Columbus Day weekend, on roadways with a history of high crashes. And again, resources for this can be found in traffic safety marketing. The resources for Operation Crash Reduction, the Maryland Highway Safety Office has, and they have some things that we've given them as well to promote that that dangerous weekend in our region. So if you need information from me, Cindy's got my information, but here it is here as well. If you need anything from me, from NHTSA, I'm here to help. Again, I get around to all 7 states. And if, of course, you need anything, please feel free to reach out. That's all I have, Deb and Cindy, and I will stop sharing.
Thank you, Frank. Are there going to be any will there be any media support for that particular effort on the weekend of the 6th through the 9th locally that you know of?
Is there any media support currently that I've heard of?
Yeah, coming up for that weekend.
Yeah, MHSO is getting the word out to all of their media partners.
Okay.
I don't know who they have gotten the word out to, but I know that I have heard from MHSO as well as the other highway safety offices in our region, and they plan on getting the word out that weekend. They have every year that we've asked them to do that. So
Okay.
I know that MHSO is working on media resources, whether it's social media, whether it's going to be broadcast or radio. I couldn't tell you exactly, but I know that they've already asked for information way back in September, and we gave that to them.
Okay, thank you. I think our organization is poised to do a couple of events where we can share this campaign and support what you're doing. So thank you. And with that, Breck.
All right. Good morning, everyone. Can you hear me okay?
Yes.
All right. Okay. I need to share my screen, and it says one participant can share at a time. So I guess someone needs to. Okay, thank you. All right. Okay. Now I'm usually a Teams user. So can everyone let me know if they see my presentation?
We can see it.
Okay. And it's taking up the whole screen, right?
I think it depends on the view of the individual and how they have their settings, but you've got everything perfectly right on your end.
All right, good. All right, let me go ahead and get started. I think most people here, I know and maybe know me, but if not, I'm Brett Jeffers, and I'm the Operations and Safety Program Manager here in the Federal Highway Administration's Maryland Division. And today I want to talk with you about equity and the safe system approach. And one of the interesting things is that, with Frank's presentation, you will get to see firsthand on how us at USDOT, kind of stay on message. You'll see some of the same things, or, I'll cover some topics that he also covered. So, in this presentation, I'm going to go over these 5 topics that you see. I'll start with an overview of equity, USDOT's equity plans and policies and programs that support the goal of reducing inequities across our transportation systems and communities they affect. And the next sections address the intersection of inequalities and the traffic safety problem, and also provides information on the principles and elements that make up the safe systems approach. And then I'll discuss how equity integrates in the safe systems principles and specific strategies. And then I'll conclude with some additional resources that you can use to bring equity and the safe system approach to your agency and your communities. Now, for the first time, USDOT has centered equity as a department-wide strategic goal. This is a critical step to institutionalizing equity across the department's policies and programs. And this is with the aim of reducing inequities across our transportation systems and the communities that they affect. Now, underserved communities are defined as populations sharing a particular characteristic, as well as geographic communities that have been systematically denied a full opportunity to participate in aspects of economic, social, and civic life. These include communities listed, on the slide here, and also including the broad category, persons otherwise adversely affected by persistent poverty or inequality. Now, I'm kind of sure people have seen this graphic or another representation of it, but I just want to state that transportation equity means safe, accessible, affordable, and reliable mobility that facilitates social and economic opportunities and meets all the needs of all community members, particularly those identified as underserved, disadvantaged, or overburdened. Now, this graphic shows that under equality, everyone gets the same resources, but under equity, the specific historical and present day circumstances and abilities of the individuals and communities are taken into consideration to provide appropriate solutions that provide everyone with opportunities to live safe and healthy lives. Now, this section that I'm going to discuss provides information on how equity integrates into the safe systems approach. Now, traffic fatalities are a public health crisis affecting all road users, and it demands a concerted response. Now, each year, there's more than 1 million lives lost globally from traffic crashes. And in 2020, an average of more than 100 people lost their lives on roads in America every day. Now, fatalities of pedestrians and bicyclists have been increasing at an even greater rate than other road users. And you can see that, from this graphic here. Now, traffic fatalities and serious injuries disproportionately impact people who are Black and Indigenous, especially as pedestrians. People who are young, old, have low incomes, have disabilities, experience homelessness, and live in rural communities are also disproportionately impacted. Now, this graph represents an overview of the safe system approach. There are 3 key components to understand, which I'll explain on this side and also other sections of this presentation. These are the safe systems approach, principles, and elements. The safe systems approach is shown by the graphic on this slide as the broadest term and describes all aspects of the safe system. In addition, the term safe system is a singular, and it is used to depict the overall safe road system. Now, this section of the presentation, I'll give some information on how equity integrates into the principles of the safe systems approach. Now, there's 6 safe system principles, and they're shown on the outside ring of the graphic, and they're also listed on both sides. And they are the fundamental beliefs that the approach is built on. They establish the goal of the safe system approach, acknowledge human limitations, and set expectations for how to act. And a successful safe system approach weaves together all 6 of these principles. Now, the first principle is that death and serious injury is not acceptable. While no crashes are desirable, the safe system approach prioritizes crashes that result in death and serious injury, since no one should experience either while using, the transportation system on a daily basis. The goal is to modify how users, vehicles, transportation infrastructure, and emergency response operate to reduce the likelihood of crashes. Now, the next principle is that humans make mistakes. People will inevitably make mistakes that can lead to crashes. But we can design and operate the roadway system to accommodate human mistakes to avoid death and serious injuries. And, taking a look at this graphic, I know myself on a daily basis, I hate to say it, but I see a lot of instances like this, and especially, in locations around schools and other places, people do hazardous things at times. And, through better design, hopefully we can try to protect them. Now, when it comes to crashes, it's important not to victim blame. Traffic fatalities and serious injuries are often influenced by multiple factors. Now, an individual's behavior is key, but these behaviors are also influenced by the individual's environment and the design of the system. Instead of victim blaming, we need to examine the inequities and living conditions that may impact people's decisions. Now, the next principle is that humans are vulnerable. And, this chart, and I'm pretty sure everyone's seen a lot of, these graphics that I'm going to show about the safe system. But, the overarching theme is that, humans are vulnerable, and the safe system approach, focuses on managing speed, but also managing kinetic energy to protect vulnerable road users and to do our best to protect them from these hazardous situations where, they may get into a crash with a larger vehicle. In addition to vulnerability, social risk factors increase human vulnerability. Planning and engineering solutions can prevent or minimize these social vulnerabilities. Now, for example, decision-making processes in transportation safety planning and funding may not have included meaningful engagement with the public. Identifying communities experiencing disparities and engaging with them to understand their specific concerns, priorities, and needs while implementing solutions can, redress historical inequities and minimize current social vulnerabilities that they face. Now, the next principle is that responsibility is shared. System managers, vehicle manufacturers, law enforcement, EMS, and system users all have a responsibility to build and use the system that prioritizes safety and creates livable communities. Examples of this shared responsibility include system managers designing facilities with proven safety countermeasures, like roundabouts or median barriers. Also, system managers keeping roadway systems in a good state of repair. Vehicle manufacturers applying the latest safety features in vehicles, law enforcement equitably enforcing traffic safety laws, and users of all the travel modes safely moving throughout the roadway system. Now, to ensure shared responsibility, the lived experiences of individuals living in communities and the knowledge of experts beyond the transportation discipline must be integrated into the planning, design, and operations of a safe transportation system. Now, the impact of community contributions encourages early and continuous public involvement and brings diverse viewpoints and values into the transportation, decision-making, and development process. Now, I know I'm moving kind of fast because I've got, a number of slides, but if anyone has any questions or has any comments, let me know and maybe I can answer them. Now, our next principle is that safety is proactive. In addition to crash-based analysis, transportation agencies should use proactive tools to identify and mitigate risks in the roadway system, rather than waiting for crashes to occur and reacting afterwards. This process, known as the systemic approach to safety, uses crash history, roadway design, and other data to identify patterns in geometric design that lead to certain crash types. And with this, system designers then identify appropriate countermeasures to mitigate crash types. And these countermeasures are systematically applied to all locations meeting a particular geometric design. Now, rather than managing risk at certain locations, a systemic approach takes a broader view and evaluates risk across an entire roadway system. A system-based approach acknowledges crashes alone are not always sufficient to determine what countermeasures to implement, particularly on low volume, local and rural roadways where crash densities are lower, and in many urban areas where there are conflicts between vehicles and vulnerable road users. Equity metrics, including demographics, social, and public health data, can provide predictive and systemic methods of identifying and prioritizing locations with high fatal and serious injury crash risks. Implementing countermeasures proactively by prioritizing underserved communities will help redress disparities experienced by these communities over time. Now, the final principle is that redundancy is critical. Reducing risk requires that all parts of the roadway system are strengthened so that if one part falls or fails, people are still protected. Now, this was the last of the 6 safe system principles. And now I'm going to go into equity in the safe system elements. Now, the 5 safe system elements, which are highlighted in this middle ring of the safe system graphic, are conduits through which the safe system approach must be implemented. Now, the key focus of the safe system approach is to reduce death and serious injuries through design that accommodates human mistakes and injury tolerances. Making a commitment to zero deaths means addressing every aspect of crash risks through the 5 elements of a safe system. Now, the first element is safe roads. Now, safe roads are designed and operated to prevent crashes and keep impacts on the human body at tolerable levels. Critically, safe roads must create complete networks to serve people of all ages and abilities, using whatever modes of transportation they choose or rely on. Now, the safe system approach must also address the safety of all road users, including those who walk, bike, drive, ride transit, use assisted mobility technologies. Now, people experiencing homelessness should also be considered. All road users are considered equal, regardless of how they choose to travel. Now, universal design is an approach to design an environment so that it is accessible, understandable, and usable to the greatest extent possible by people of all ages, sizes, abilities, and disabilities. Now, the 7 principles of universal design are shown here on this slide. And, by using these, hopefully in the future, we'll be able to design and implement an environment that'll help, save more lives. Now, achieving safe roads requires investing in equitable and underserved communities. First, prioritize equity factors in funding formulas and project prioritization. For example, a locality may use predictive equity metrics like DOT's Disadvantaged Communities GIS tool to distribute funding. Second, assess how certain criteria may unintentionally exclude underserved communities and widen disparities. For example, a state may remove local matching requirements from their funding distribution formulas to avoid unintentionally shutting out localities with low capacities. Third is to provide additional resources, including capacity building and safety study funding to underserved communities. An example of this, a higher capacity local may partner with a lower capacity local to bundle safety projects and implement countermeasures systematically. And fourth is to engage in a meaningful public involvement. Now, finally, achieving safe roads means equitably managing or replacing facilities to ensure longevity. Now, upgrading facilities based on complaints may unintentionally leave underserved communities out. Systemic approaches for upgrading facilities may improve safety in a more equitable manner for all communities. And yeah, I'm going to go ahead and finish up. This is the last section of the presentation. Now, USDOT, we have a website, and it's provided here, and I'm sure Cindy will either send a presentation or I'll give her the links to send, where you can check out this website that provides more USDOT resources on equity. My agency, Federal Highway, we have a safe systems approach website, or better yet, on our Zero Deaths website, you can get more information on safe systems approach. And another resource is my agency, Federal Highway. We have a series of webinars, Equity and Roadway Safety. And these are excellent webinars. I believe there's one coming up in November. And this website also has recordings of all the previous webinars in this series. And I strongly advise everyone to take a look at this. There's a lot of, good information that you can get from this webinar series. And just to close out, zero is our goal, and implementing safe systems is how we get there. And let's see, let me figure out how to stop sharing my screen. So any questions, comments? Or maybe Cindy, can you maneuver this? And
So I see the agenda again, Breck. Thank you
Okay.
for the presentation.
All
And I
right.
don't see any questions in the chat for either Frank or Breck, but if you want to chime in, if you do, now would be the time to do so.
I did get one for either one of you, actually, or maybe both of you. It's also a question that crossed my mind, so I'll take ownership of
Okay.
it in case you don't want to hear it. But with the potential of a federal government shutdown in a couple days, will that affect any of the October plans for you, Frank, or any of the upcoming equity outreach materials you talked about, Frank?
As far as our stuff in October, no, because that's all funding that is already there. States would just be able to use, or Maryland in this case would just be able to use, funds that have already been approved that are carried over from 2023 and previous years. You don't all of a sudden lose funding at the end of a grant year or anything. So there's funds out there that highway safety offices can continue to operate on, even if there were to be some type of a shutdown. So no, it won't affect anything.
And to echo Frank, on the Federal Highway end, no, we don't anticipate any hiccups or pauses in the funding or anything like that. And also too, if there were, any issues at an executive level, we would reach out to the states. But from everything I'm hearing, it's no. And this isn't the first rodeo for a lot of us. It seems like these things happen every few years.
I'm still hoping for a midnight continuing resolution like we used to always get. So,
Yeah.
all right. Well, thank you guys. I don't see any other questions, Debbie, unless.
I have one question. This is Fritz from Baltimore County.
Mhm.
For Frank, for your Operation Crash Reduction, your Move Over or Slow Down campaign, can we just go to the website, grab whatever information you have and post it on Baltimore County website to kind of like follow through with that? Because we've been starting a safety campaign every month. So would that be?
Yeah, well, for us, for NHTSA, you can go to trafficsafetymarketing.gov, and there's information there on slow down, move over, on there, along with all the programs that NHTSA has. Pedestrian safety, there's all that entire, all the stuff for pedestrian safety is on trafficsafetymarketing.gov. So I would suggest going there. And then if you wanted something more localized, you could contact the Highway Safety Office, who has all of the information that we provided to them for Operation Crash Reduction. So the Maryland Highway Safety Office, their communications section would have all the information that we provided to them, or their outreach folks would have information that they could give you for Operation Crash Reduction. And then for Baltimore County Police, I know Debbie mentioned earlier about the website for like law enforcement, and that's www.traffictrainingteam.com. And that is for law enforcement to get information on the various classes they do, and specifically here today, the cannabis course. Does that answer your questions?
Some of it. That answers some of it.
Hi, this is Cynthia Spriggs from the Highway Safety Office. I just put a link in the chat for our October resources for the digital resources. So all of that information you guys should be able to download in there, to include our support for all that Frank was talking about, all of our Be the Driver stuff as well.
Okay, and we can just post that on our website, right?
Yeah, you'll be able to see it's
Okay.
a digital resource kit. If you don't, and this goes to everybody in the group, if you don't already subscribe, you can subscribe and they'll come out to you monthly. You can reach out to me directly if you have questions. I'm also going to throw the Walktober, Walk Maryland information in the chat as well. Francine Waters from the Secretary's office does a fabulous job putting together everything for Walktober.
Thank you. Any
Oh.
other questions, Cindy?
Can I just add one more thing?
Of course.
Okay. And I didn't have a chance to, squeeze this into my presentation, but when it comes to equity and using it in a process with the recent vulnerable road user assessment that M.SHA was working on, that is a good example of using equity as part of a safety planning process. And I believe Jay is on the line, and if you have any questions about actually incorporating equity, Jay Zhang would be a good person to reach out to.
Thank you.
Okay.
And Jay is on the line. We're going to move over now to the next agenda item, which features Julie Critter and Mike Baumgartner of the Highway Safety Office, and they're going to talk about their CarFit program, which is one of my very favorites. So, shameless plug, I am a CarFit tech. I'll be glad to join any of your events if you ask me. So with that.
Well, you're going to start getting some invites, Debbie.
Breck, you might have to stop sharing your screen before they can. I'm not sure. Julie and Mike, you should both be co-hosts if you want to try to share.
Hi, everyone. Can you see my screen?
Yes.
So let me get started. Mike, are you on too?
I'm on, but I don't see your screen.
Yeah, I see Breck's slide. I don't see Julie's.
If
Do
you
you
go into view options, there's a option says shared screens, and you can select Julie's instead of Brett.
Oh,
Everybody can do that under the you see the Zoom menu, the top says view options.
Well, you learn something new every day.
I just learned that too.
yeah. Thanks, Eileen.
That's cool stuff.
Are we good now, everyone?
I can see your screen, Julie.
Oh, hello, Ma.
Perfect. I can't
Did
see
you get my
myself, but
message?
that's okay. Just wanted to say thanks to Cindy Birch for having us
Okay.
this morning to talk about CarFit. So Mike Baumgartner and I are part of the community engagement section at the Motor Vehicle Administration's Highway Safety Office. And our mission is dedicated to saving lives and preventing injuries by reducing the number and severity of motor vehicle crashes through the administration of a comprehensive and effective network of traffic safety programs. What that really means is that our goal at the state level is 0 deaths, and we work with numerous partners. And thank you for everyone that is actually at today's meeting, because I believe somehow in some way you are also doing the same thing. So we're going to talk about a program that is created for mature drivers to find their safest fit. If you all know me, you know that this is my favorite group to educate. And at the state level, it is now my focus area. So it is the mature drivers or older drivers, as we like to say. But when I am with them, I call them my seasoned gems, because Queen, who most of you may have known, was one of my best coworkers back in the day in community outreach. And when I see this group, I just want to provide them with everything to be fit to their car, as well as to educate them on the roadway. So Mike and I are going to go through a checklist, and the creation of CarFit was created back in the day in about 2006. And it was created by the American Automobile Association, AARP, and the American Occupational Therapy Association, AOTA. So it is a free community event, and it offers older adults the opportunity to check how safe they are in their vehicles. Basically, what that means is we get them fit in their vehicles. We also provide information, and I'm hoping, fingers crossed, and Cindy Birch, I may need your assistance. I'm going to try to click right here, and hopefully you all will be able to see our CarFit video. We're going to skip that ad.
Still to see your PowerPoint. We don't see. Are you only sharing your PowerPoint application, or are you sharing your whole screen?
Hold on.
Gotcha.
Hold on.
And then when you go to share, there should be an option that says optimize for video and sound or something on it. A little checkbox. And you're muted.
Can you see my screen now?
No.
No?
No, I was before and I'm not now.
Okay. All right, let's jump over here.
It doesn't show you as sharing anything, so you might have to hit the share button again.
Let me start there. Let me jump in here. How about now?
Now we see your PowerPoint.
Okay, but you don't see, do you see CarFit?
Yes.
Okay. So if I click on here, do you see this?
It's just the same slide, Julie. It's not opening.
Let me see if I can get it to open on mine. I'll share my screen if I can get it to work. Okay.
And wonder why they.
People over the age of 65 are the fastest growing population in the United States. By 2030, more than 70 million Americans will be 65 or older. With age comes natural changes to vision, information processing, flexibility, and the speed of reflexes. And vehicles are changing too, with the addition of more safety features that require adjustment to find the safest fit.
CarFit is a community-based educational program for older drivers focused on safety, comfort, and fit. CarFit was created in 2006, and it was a joint collaboration between AAA, AARP, and the American Occupational Therapy Association.
CarFit is designed to operate successfully in a variety of locations in the community. It's an education program that can be offered in conjunction with AAA or AARP driver safety courses, anywhere that we can establish a place to have a community education event. Or we can have our trained technicians also offer CarFit as a one-to-one education as well. At a CarFit event, a driver pulls up in their own vehicle and they're able to assess their fit. We provide education, we show them how things work, and we provide some community education, some resources that they might find useful. The technicians at CarFit follow a 12-point checklist that guides them through the main safety features in the vehicle, takes 20 minutes, and off they go.
CarFit events are led by volunteer event coordinators who supervise trained CarFit technicians, occupational therapists, or driver rehabilitation specialists. CarFit provides an educational experience. This can prompt a conversation about the steps the driver can take to make him or herself more safe and comfortable in their own vehicle.
The CarFit partners thank all of our volunteers for their service.
Thank you, Cindy, for that help, and I apologize that you had to hear that twice. All right, let me get back on track. All right, can you all see this?
No.
Okay. Hold on one second. All right, let's go right here. Okay, how about now?
Yes.
Thank you. All right, so I'm going to have Mike Baumgartner go ahead and take care of this portion of the presentation.
All right, Julie, you're going to advance the slides when I need to, I guess. So what we did, and Julie and I were pretty much by ourselves for a number of months through the pandemic. And we started reaching out to senior centers to get this going again because AAA Mid-Atlantic kind of backed out of it. So we wanted to make sure that our seniors were being taken care of in the community. Myra Weeman, who is our deputy director, jumped in, trained us up as techs, made Julie and I think Rachel Andress coordinators as well. So we started reaching out to community centers, churches, just finding locations where we can do this, and it's really taken off. And the cool thing about this is a lot of these senior centers remember this program from years past, and they've wanted it, but there's been nobody to be there for them, get them the help that they've wanted. So now we're now able to provide this for them. We just did one down at Indian Head Senior Center last Wednesday. We had 12 people come through. The hard part for us though is finding an occupational therapist to help out, because they tend not to be able to get away from work. But in this particular case, the Charles County is at La Plata Hospital up there. Were contacted about it, and they said since it was for the community, they sent an OT down, so that was pretty amazing for us. But Julie's been very active in the Baltimore region to get this done. Well, basically what it is, we set up a location with the, we usually go out to the facilities to see if they have the room for us to do what we need to do. So you have your place where they check in. Kim, I see your question in the pop-up chat. I do not know. I think it's going to have to go with the individual insurance companies, because like some of the trainings that I've attended and others have attended probably on this call, some insurance companies just don't care. They give you discounts other ways, so you have to check with them. But what we do is we have them check in at the very beginning of the event. At that time, they're usually, I'm getting some feedback from somebody. At that time, they're usually given a waiver to fill out. It's just going over the fact that they weren't forced to come there, voluntarily there for us to help them be safer in their vehicles. We also ask them if we can use their pictures for any social media posts that we may use. And then they are given a checklist where they will drive to the next station, and we guide them into that station, have them park. We position them so that we can have them check the rear view mirrors properly, have them check the side view mirrors, eliminate blind spots. We go over this checklist with them. We check their seat belts. It's really funny. A lot of them don't know that their steering wheels tilt. They don't know that their steering wheels telescope in a lot of the vehicles. They don't know that their seatbelt is adjustable on the A-pillar, which is the part right by your left shoulder when you're driving. And so a lot of the complaints from them is the seatbelt rubs their neck. And then when we ask if we can get into the back seat and open the door and adjust it, and we lower it down, and they're just amazed at just how much more comfortable it is. So we do that. We also make sure that they're not sitting within 10 inches or closer to the steering wheel because of the airbag. We check that. We check to make sure that they can see 3 inches over top of the steering wheel so they get a better view of the road. And sometimes there may be some adjustments we have to make on the seat. Some of these individuals don't realize that they can raise the seat up with the button on the side, or if it's an older vehicle, we may have to give them a booster, so to speak, the wedge. Julia, what's the right term for that? Wedge?
It's called a seat cushion.
But it's okay. All right, seat cushion looks like a wedge. But we get them to where they feel a lot more comfortable, a lot safer. We eliminate their blind spots. We adjust their head restraints. Some of them will have a thing all the way up, and some of them have. There's been a couple times we've done car fits where somehow or another the headrest got pulled out and put around and backwards, so it wasn't doing what it's supposed to do either. Next slide. This is another thing we look for. We want to make sure that there's ease of motion from the gas pedal to the brake pedal. In this day and age, we don't see too many clutches. I haven't seen anybody come through with a car with a clutch. But we have to make sure when we're doing this that they're looking forward so that they don't look down at the pedal and the gas, the gas and the brake pedals. We want them looking forward. We want to make sure that they can reach it easily, and that there's also not floor mats that are crumpled up, or carpeting that's crumpled up, or there's water bottles or something like that could impede them being able to push that brake or gas pedal safely. This is the really important part. This probably, in my opinion, the most important part of it, other than the airbag placement, is eliminating this blind spot. And so we do this, and it's, with older drivers, their mobility is a little bit different. They have a lot of stiffness in their neck. They may not be able to turn their head as much. And just by adjusting the mirrors out for them, and as you can see, the young lady in the background's kind of blurred out. She's holding up 3 fingers, and the person talking to her is actually asking her questions. Tell me when you can't see her anymore. And we have the other person walk slowly out of the view, and then we have them adjust the mirror back out so they can see. So what they're doing is eliminating as much of that blind spot. So they just, in some cases, they just have to turn their head slightly, and they can see the person standing there as opposed to before they couldn't see him at all. Because somewhere along the line, a lot of us were told to have our mirrors focused on the sides of our cars. And like I tell all these folks that, yep, they have nice, pretty shiny paint jobs, but we don't need to see that while we're driving. We need to see the cars next to us. And when they realize that, they look at me and they're like, oh, okay, that makes a lot more sense. So now they can see more of the road and they feel safer. So the OT does their job where they're checking for stiffness. These are, there's qualifications that they have that we don't as regular technicians. But they will address those with the drivers. They actually have some tools that they show them to help make life easier. We may even put give them blind spot mirrors, for example. And this is where the occupational therapist comes into play. You can see, I called it a wedge that's on the left, the very first picture there. And then you have the handlebar there, which they can shove down into the latch on the door, and it's just an easier way for them to push and get out of the vehicle. And it doesn't damage the vehicle, but it's a little quick, easy tool that can be put down next to the seat or in the center console, or wherever they want to store it, the map pocket in the door. And it just makes it a lot easier for some of these folks to get in and out. And then you see the device that the lady's using to reach over to pull the seatbelt as well, if it's difficult or hard for her to reach, maybe from a shoulder injury or whatever the case may be. And
Mike,
Julie,
you and I can share this one.
Yeah.
Thanks, Mike, for identifying all of the 12-point checklist items in CarFit. As Mike said, this all really was started probably, I've been a CarFit tech since 2009, and Myra Weeman was my instructor as well. So after COVID really took a toll, especially on the senior centers, Mike and I, as well as Jennifer Gray, who is on the Eastern Shore, and Mike Davies, who is in Western Maryland, we've been really focusing on this age group to get CarFit in the centers. So Harford County, if any of you are familiar, Julie Syjak is not only a car seat coordinator and instructor, but her and Barry Klein from Healthy Hartford and Julie's from Upper Chesapeake Health, they do a lot of CarFits in Harford County. So that's a great partnership to have. We do work well with them, as well as provide any tech support that we can. I was in Frederick with Mike Davies last Friday, and the Frederick County Senior Center had a Seniors in the Park. So we teamed up with them and had CarFit, and we had about 11 appointments, which was really great. And then going to Baltimore. So this past spring, I have partnered with the Baltimore County Department of Aging and provided older driver safety presentations at numerous senior centers throughout the county. So I'm trying to put together 4 CarFit appointments at 4 different senior centers. Right now, one will be held on October 11th, and that's going to be in Parkville. We have 5 appointments. And then also November 2nd, we will be at Z's Senior Center as well, and they have 4 appointments. So we're working on a couple of other centers, and it seemed as though when I was with the seniors back in the springtime for the presentations, this is something that they would like. Keep in mind, this is a free program. This is something that has been evaluated. We have the checklist. We have everything, like Mike said, we provide to the centers, to the churches. As you can tell on this flyer, up in Harford County, they had it at St. Mary's. So when it comes to this, when it comes to appointments, we highly, highly encourage the center to take care of that, since they know everyone there, and as well as reminders. But it's a great program. Mike, is there anything you wanted to add?
I would just say this, it's probably one of the most beneficial things for the seniors, and generally I haven't had any negative feedback at all from anybody that's been to any of these events, has had us adjust their cars. We just, like I said, we just did the one in Indian Head, and the coordinator there was like, oh my gosh, everybody loved what you did. There's other people that couldn't make it that have heard about it. So can you come back? So it's very rewarding, and it's very needed for these older drivers, who some of them still have to go out and work, and you know, take care of their families because of the trying times we're all in. So it's nice for me to feel that that we're helping these folks, you know, drive safer. The other thing is, if there's anybody actually on this call who's interested in getting trained in this, we are doing, unfortunately right now, this one is closed to outside people, but Baltimore County Police contacted me, and we're going to be doing a training for them on October 18th. And we like to keep it kind of low numbers because, you know, you have a lot of outdoor stuff you have to do with the cars once you're done with the inside classroom portion. So we usually try to limit the number to about 10 people or so, so that we can, you know, manage that class easily, and we can get everybody there, and you're not tied up in a training for 6, 7, 8 hours. Generally it takes us about, you know, with the class of 10, it'll take us about 4 hours to get everybody through it.
Mike.
So thank you. Go ahead.
I was just going to wrap it up. So if you all need anything, you know, here's our emails. Feel free to reach out to Mike and myself. Thanks.
Thank you both. I have advocated for this program for years, and I appreciate the presentation because there's a couple of things that I realized during it. So I know we're short on time. Julie, I'll reach out to you, but I think there's some things that we can do together that will help your program, but also make a big difference as far as maybe the employer perspective of taking care of their older employees. And then next on the agenda, we have local strategic highway safety plans. Cindy, do you want to cover that?
Sure, and I'll be brief. I apologize to be so brief. If anyone's on the call that wants to speak up after I give my little recap. Anne Arundel County is working diligently. They're going to have a draft action plan for their Vision Zero plan. The goal is to have it by Thanksgiving. Queen Anne's County applied for, several of you applied for Safe Streets and Roads for All funding. They applied for it so they could build a local SHSP. So hopefully that will get done during the course of next year. Howard County is still plugging along with their infrastructure review of fatal and non-motorist serious injury crashes, similar to the state review that's happening on fatal crashes. And Baltimore City's got the second round of funding proposal in, and putting the first round to good use. Baltimore County put in for the second round of Safe Streets and Roads for All funding, Harford County continues to meet their strategic or their traffic safety advisory board, and we're hoping to get a draft evaluation, hopefully, of their previous plan done by the end of this year. So lots of different stages with everybody in the region, but lots of great stuff going on. Carroll County just, their sheriff's office just purchased a bunch of speed signs, and in the press release, the sheriff directly attributed it to an action in their safety plan. So got some press there as well. That's all I really have for locals, unless anybody wants to add anything.
Nope, that's a great wrap up. And then we have new business. I believe that Tracy has one thing that she wants to talk about.
Oh, are you still there, Tracy? I have lost my participants list. I don't know if she's. Cynthia Spriggs did put something in the chat for everybody, and I'll send out a follow-up email this afternoon as we get ready for for Pedestrian Safety Month. And she talked about that we're going to have a Twitter chat with Signal Woman. That's our regional campaign, Look Alive with Signal Woman, a Twitter chat on October 4th. And I'll also send out some dates when we'll have street teams out in a few of our jurisdictions.
Okay, and then in the chat, Cindy, if you could include it, I gave the links for the 2 data sources that I mentioned in my presentation.
Yep,
one was for Insurance Institute's data, and the other was for National Safety Council's article.
Absolutely. And it looks like Tracy had to hop off. So I will ask her for what she wanted to share, and I'll put that in the message as well. So you guys will get a message from me this afternoon with a bunch of links to everything we heard from our presenters today, as well as what she was going to say about that. And then the other thing I'm going to ask of you is, you see on the screen, we had a roundtable discussion, but we didn't have time for that. I'm going to send out our current roster and ask if anyone sees any gaps or any new partners they would like to add to this committee. We just want to revisit the membership every few years, and it's about that time. And you'll see that. I'll ask for that in my message as well.
Okay. Thank you, everybody, for joining us. We're 2 minutes late, but that's not terrible considering how much we packed into today's agenda. And we'll see you next on December 14th. Looking forward to it. Have a great day.
Thanks.
Thank you. Take care.
Bye.
Bye.
Take care.
Thanks.